Hello students, we'll briefly discuss a postoperative status today. What this postoperative status is, look at this scrotum you can see the perineum here, Foley's catheter is coming down, you can see the sutures here, probably 30 vicryl, where perineal urethra is sutured to the skin by making an incision there. This is where perineal bulbar urethra is there. We know that urethra has got part, prostatic urethra, membranous urethra in the membrane, perineal membrane, then bulbar urethra, then penile urethra. So urethrostomy is done just at the bulbar urethra, and this is what exactly is done. So what is this? It is a perineal urethrostomy. So what are the indications? Commonly it is after total amputation of the penis or penectomy done for carcinoma penis. Sometimes it is done for diversion for any urethral injuries as a diversion. Either you do a perineal urethrostomy or suprapubic cystostomy, SPC. And in carcinoma penis it is permanent urethrostomy actually. Problems of the perineal urethrostomy are stricture of the urethra, urethritis and cystitis, lower urinary tract infection, and sometimes oozing can occur. Psychological worry for the patient because natural way of passing urination is not there. So that is the point you have to remember. So perineal urethrostomy, this is how exactly it looks like. It is done as a permanent entity in total amputation of penis. It is done often as a temporary entity in urethral injuries or urethral sepsis or in urethral conditions where temporarily you don't want urine to pass down, so that give rest to the area so that it promotes healing. That for many maybe urethroplasty, surgical approach for urethra, whatever it is. So that is called perineal urethrostomy. So answer the MCQ. Circumcision is contraindicated. All of you know circumcision. It's very commonly done entity, operative procedure for phimosis. So circumcision is contraindicated in A. phimosis, B. melanocytitis, C. paraphimosis, D. hypospadias. So students, please put the correct answer in the comment box. We'll have a discussion about that later. Go through my clinical methods in surgery with the video of how to examine the patient, manual of surgery in detail about every topic for UG syllabus, CBME, and my operative surgery 2 volumes gives everything about technical aspect, and my DigiNow lectures through JP Publishers covers everything for UG's charities and operative surgery, instrument, specimen and images, basic for PGs also. So students, I hope you have understood this lecture very well. Thank you very much.